Hi, Dr. Mark here again for Newnham Family Dental. Here today, I have my associate, Dr. Tiffany.
Hey guys!
So today we'll be helping to debunk some of the dental myths. Retainers aren't for life.
So for those who don't know what retainers are, they get made after you finish your braces or Invisalign. Usually they're either a wire that gets glued in behind your front teeth. They can also come as a clear plastic tray that you wear every night. Long-term studies have found is teeth actually do continue to move and shift over time. If you don't want your teeth to start moving again, please keep wearing your retainers.
Yeah, so oftentimes we have patients who come in perhaps in their 20s or 30s and they had Invisalign or braces done at a younger age. When they do not have retainers made or wear them consistently, it actually led to a lot of relapse, so their teeth move back to its original position. If you don't wear a retainer, you may end up having to do braces or Invisalign again in the future.
Braces are just for crooked teeth.
Braces is that not just for crooked teeth. So a lot of times braces can help with whether you have crooked teeth or actually have a lot of spacing between your teeth as well. Or simply even for very minor corrections, just to make your smile look a little bit more beautiful.
Braces can be done for functional reasons as well. If you have any problems with your bite, some people have a big overbite or underbite, crossbite, open bite, anything like that, we can do braces to fix that.
If there's a gap between your teeth for a long time, sometimes the teeth behind actually tend to tilt in and closes the space. So with braces, you can also create that space back to its original shape, and then you're able to do bridges or implant after that. Veneers last forever.
Veneers are durable, they can last for a long time. However, like everything else in life, they don't last forever. How you can increase the longevity of your veneers, there's a few different ways. The first and easiest way is to just make sure that you're keeping up with good oral hygiene. Brushing and flossing every day is really important to prevent decay from forming around your veneers, and it also helps prevent staining. Some people who may be grinding or clenching, we also recommend making a proper mouth guard or night guard to wear just to help protect their beautiful smile. To get veneers, your teeth will need to be shaved down like a shark's tooth.
So for veneers, it is actually very wafer thin. So it's sort of like a fake fingernail that attached to the front surface of your nails.
The shark's teeth that you see all over social media, I would say a lot of those aren't actually veneers, they're probably crowns.
So generally, we like to keep the veneers in what we call enamel, which is the outer layer of your teeth.
First reason being obviously we get to preserve a lot more tooth structure. Second reason is the enamel also helps reduce any post-op sensitivity as well. And the other reason is enamel contains some minerals that you don't find in the inner layers of your teeth. And those minerals are important for the bonding or the glue that holds your veneer onto your tooth.
So chewing gum is just as good as brushing.
So this is false. Chewing gum is very different from brushing. With brushing, you're able to get that mechanical disruption to the bacteria buildup on your teeth. Chewing gum is not completely bad though if you're chewing sugar-free gum. If you chew sugar-free gum, then it can help stimulate saliva flow. It increases your saliva production, and saliva contains a lot of components that can actually protect your teeth from developing cavities. Teeth grinding is not a serious problem.
So a lot of times teeth grinding is actually due to two main things. So one is actually due to stress. So a lot of times people who are in a very stressful environment or they have a lot of stresses in their life, they tend to grind their teeth. And the second thing is potentially they have some airway issues as well. Okay, so for example, people are actually mouth breathers. that actually causes teeth grinding at night times. So teeth grinding actually can become a serious problem because with teeth grinding, it actually wears away the outer layer, which is called the enamel of your teeth. The enamel is what protects your teeth from sensitivity and damage to the nerve. So it is very important that if you got teeth grinding issues, one, we need to make sure that you don't have any airway issues, and second, we can make you what we call a night guard or a splint in order for you to wear at night to protect your teeth from further wear. Cavities are irreversible.
So if the cavity is just confined in the top enamel layer, then it is actually reversible. The enamel has capacity to do a process called remineralization, and that's when if you brush and floss well, then through your toothpaste you can get more minerals into the enamel, and that can actually reverse the process of a cavity. If the cavity reaches the second layer, which is called the dentine, then it is not reversible. So whenever we recommend doing a filling, generally it is already irreversible and it's best to get it done sooner rather than later. Toothaches always means cavities.
So toothache doesn't always mean cavity. It can definitely mean cavity, but it could also mean a variety of things, such as having sinus problems. It may cause that sort of pain as well, or it could be simply food packing between your teeth. Other concerns could be gum disease or having gum infection, or perhaps if you got an abscess in your tooth. So toothache could mean a variety of things, so please don't self-diagnose and see your local dentist. Dental cleaning unnecessary.
So if you want to keep your teeth for the rest of your life, then definitely we would strongly recommend to have regular dental cleanings in conjunction with dental examinations. So when you're brushing and flossing at home, that's really important to prevent buildup, but you will still get a little bit of tartar buildup around your teeth and your gums. We use special tools and instruments, including something called an ultrasonic, which is a scaler that produces ultrasonic vibrations and water, and we use that to gently clean the tartar buildup off of your teeth and your gums. For most people, we recommend coming in for a checkup and clean every 6 months. Some people who get build-up more easily, we even recommend coming in more frequently, say every 3 months. So it really all depends on the person.
So the most important thing to take is that make sure you're trying to brush twice a day and floss twice a day if you could. And make sure you come at least once every 6 months for your regular checkup and clean. If you enjoy the content, please like and subscribe to our videos. And if you got any questions or any myth you would like to know, please comment down below. We'll be happy to answer all your questions. Thank you for watching this video, and thank you, Dr. Tiffany.
No worries, thanks for having me, guys.